We've all been there, right? That pounding, splitting headache that just won't quit. And sometimes a little voice in the back of your head starts to wonder, what if this is something serious? That's a really common fear. And today, we're going to give you the knowledge to understand what's going on.
So let's just jump right in. When does a really bad headache cross that line from being just a miserable day to being a genuine warning sign? That is the exact question we're going to break down right now.
Okay, first things first, you gotta know that not all headaches are created equal. Doctors basically put them into two big buckets, and telling them apart is the first step to understanding any potential risk.
On one side, you have your primary headaches. These are the ones we all know. Migraines, tension headaches. They feel awful, for sure, but the headache is the problem. But on the other side, you've got secondary headaches, and these are the ones we need to focus on. With these, the headache isn't the problem itself, it's a symptom, like a fire alarm going off telling you something else is wrong in your body, and that something else could be serious.
So, imagine you're in the ER. How did doctors figure out which kind of headache you're having? Well, they don't just guess. They have a system, a powerful checklist that's been designed specifically to catch those dangerous warning signs.
And that checklist has a name, the SNOP-10 list. I know, it sounds a little technical, but it's basically a tool from the International Headache Society that gathers all the most critical red flags. Think of it as a decoder for what your body might be trying to tell you. So, what are these critical red flags we're talking about? Well, we can break them down into three easy-to-remember groups. Things about you and your medical history, things about the headache itself, and finally, any other weird symptoms that are showing up along with the pain. First, let's talk about things specific to you. Sometimes a red flag isn't about the pain, it's about the context. For example, if you're over 50 and you suddenly get a type of headache you've never had before, that's a reason to get it checked out. Same goes if you have a history of cancer, if your immune system is compromised, or if a severe headache starts during pregnancy or in that period right after childbirth. These are all situations where a new, bad headache needs a closer look.
Okay, next up, the personality of the headache itself. The big one is what's called a thunderclap headache. The name says it all, right? It's a headache that goes from 0 to 100, just bam, peak agony almost instantly. That's a major red flag. Other warning signs? A headache that feels completely different from any you've ever had. One that just keeps getting worse over days or weeks, or what's called a positional headache, where the pain dramatically changes if you stand up versus lying down. And finally, what else is your body doing? Is the headache bringing some scary friends to the party? I'm talking about things like weakness on one side of your body, changes in your vision, or feeling confused. That's a serious sign. Same goes if you also have a fever or a really stiff neck. You should also pay attention if the headache is triggered by something like coughing, sneezing, or exercising, or if it started right after you hit your head.
But you know, it's fair to ask, this is just a checklist on paper, right? Does this thing actually work when the pressure's on in a real hospital? Well, a 2022 study set out to answer that exact question.
Here's what they did. Researchers took 100 patients who came into the ER with a severe headache. They had them fill out a simple questionnaire based on those SNOP-10 red flags we just talked about. Then, a neurologist, who didn't see the questionnaire, did their own full evaluation. The big question was, would that simple checklist be enough to catch everyone who had a truly dangerous condition?
The result was kind of stunning, 100%. The checklist had a 100% success rate. Every single patient in that study who turned out to have a serious high-risk headache had at least one red flag from that list. Not a single one was missed.
Now, in medical speak, this is called 100% sensitivity. But what that really means for you and me is that the test was perfect at its most important job. It didn't miss anyone who was in real trouble. It produced 0 false negatives. If you had a dangerous condition, this checklist was guaranteed to raise a flag.
So, what's the takeaway here for you? The goal of all this is absolutely not to make you panic every time your head hurts. It's the opposite. It's to empower you with good information so you can take the right action at the right time with confidence.
So here's your game plan. It's really just 3 simple steps. 1. Recognize the red flags we've been talking about. 2, and this is so important, don't panic, and please don't try to diagnose yourself on the internet. And 3, get professional help. If you have a severe headache plus any of these signs, it's time to let a doctor or a nurse take a look.
You know, the researchers who ran that study summed it up perfectly. They basically said that until we have some kind of simple blood test for dangerous headaches, our best and most reliable tool is checking for these red flags, and the SNOP-10 list is an incredibly sensitive way to do just that.
So we'll just leave you with this thought. Headaches are a super common part of life. We all get them. But knowing the difference between just a bad headache and a genuine danger signal, well, that's powerful knowledge to have. And at the right moment, it could make all the difference in the world.